Good afternoon. My name is Aleksanteri Institute. I'm glad to introduce Ulla Pape from University of Bremen in Germany. And she's a well-known specialist in social policy and civil society development in post-Soviet area, in Russia in particular. And she's going to present for us her project Confronting HIV/AIDS in Russia and Ukraine, a comparative study on epidemic impact and policy response. And a small disclaimer from our organizers that we are going to record the presentation but not discussion. Ulla will have 45 minutes to present her ideas, and then we will have 45 minutes for Q&A session for our comments and so on. Okay? Mm-hmm. Floor is yours.
Thank you, Andrei. Okay, welcome everybody. I'm very happy that I'm here today and that I can work at the Aleksanteri Institute. So thank you very much for the invitation. And I will now present you the project that I'm working on currently. This is a comparative project. And I'm actually looking at the policy response to HIV and AIDS in two countries, Russia and Ukraine. And first of all, I will give you an overview about what we are going to do in the next 45 minutes. So first I'm going to tell you something about the background, why I have chosen this topic and why I think that it's interesting. Then I'm going to tell you something about the epidemic impact. So this is how the epidemic has been evolving in both of these countries, what are the main factors, and why it is a problem. Yeah. Then we are going to turn to the analytical part, so the policy response, and I have divided this into 5 different dimensions, as you can see here. And I'm going to look on each of these dimensions for both of the different countries. And then I will get everything together, and will show you some comparison and give you the preliminary results of my analysis. I have to say in the beginning that this is work in progress, and you will probably see that at certain points I'm still lacking all the data. So sometimes there will be a gap in the data material, things that I'm still collecting at this moment. And in the very end, I would like to conclude with some thoughts about the bigger picture. So probably for most of you, HIV/AIDS is a new topic, and it's interesting to discuss it in a broader context. So what can this study tell us about Russia, Ukraine, in a more general context? Okay, so thank you very much. I'm going to begin with the background. But first of all, this project has, in my opinion, a practical relevance. If we look at HIV/AIDS at the current moment, we can actually describe it as an international success story. Of course, there are a lot of problems, and it's still a deadly disease, and people are dying from this disease. But one can see that the international community has been quite successful in addressing HIV/AIDS. And this was only possible because of very many people working together. So international civil society organizations have been advocating for prevention efforts for a long time, since the very start of the epidemic. And countries in very many parts of the world have also been engaged in this. And without international help and assistance, it would not have been possible to address HIV/AIDS. Yeah, and examples for this international cooperation in this field is, for instance, the UN Joint Program on HIV/AIDS, also called UNAIDS, or, for instance, the Global Fund to address HIV, AIDS, malaria, and tuberculosis, which is the main financial mechanism. And it's actually helping very many poorer countries in the world to set up programs to address the epidemic. Yeah? And as it is the Global Fund, it's not only HIV/AIDS, but it's also concerning tuberculosis and malaria. And in some countries, these epidemics go hand in hand. Yeah, tuberculosis, for instance, is also very important for the two countries that we are going to look at, for Russia and for Ukraine. So if we look at this international success story, it has also been included in the Millennium Development Goals. Actually, goal number 6 is addressing HIV/AIDS, and last year this goal, like globally speaking, had been achieved. Yeah, for that time, and now the new objective is to end the epidemic by 2030. That's the global picture, but then there's one region where we still see the epidemic of HIV growing, and this is the region of Eastern Europe. According to the definition of the World Health Organization, Eastern Europe and Central Asia is practically everything from the post-Soviet space until Central Asia. So that's the definition of this region. And the epidemic is growing still in this region, and in two countries that's there we see the biggest problems, and this is Russia and Ukraine. Yeah? So the practical relevance of my study is to understand how it can be that internationally speaking we are able to address HIV/AIDS, but not in the region of Eastern Europe and Central Asia. Of course, this project also has some theoretical background, and it is interesting to me as a political scientist is how policy is shaped in the interaction of international actors, national actors, so that's the government and governmental institutions, and civil society, yeah, consisting of different organizations. Now let us have a look at the research design. But the question is that I would like to address is how can the differences in the policy response towards HIV/AIDS between those two countries be explained? Now, of course, you have to understand what the differences are. And there are quite a lot of differences between Russia and Ukraine, mostly concerning implementation. So both countries are different in the way to which they address certain aspects of the epidemic and adopt internationally acknowledged and recognized prevention programs. Just to give you an example, prevention programs in the field of HIV/AIDS always address certain target groups or key populations that are most vulnerable to the epidemic, and one of these vulnerable groups can be injecting drug users. And prevention programs include, for this population, include all programs that reduce the likability of spreading the infection within this specific group. Yeah. And when it comes to injecting drug users, the programs include, for example, harm reduction programs. So that can be needle exchange programs where drug users can, for instance, exchange their needles into new ones. And this sounds very practical, but it's very, very useful and very, very relevant, because it helps people to actually not to reuse their equipment, and that can help them to prevent the infection from spreading via drug use. So this is one example of a prevention program specifically addressing a key population. Yeah? And you can think about different other prevention program, let's say prevention programs for sex workers, address prevention for this group of people. Yeah, and it contains all kinds of very specific information. So if we talk about prevention, it is always addressed to specific groups. Yeah, because you can imagine that different groups have a very different information need. Yeah, information needs for injecting drug users are different to those of young people in general, or of people involved in the sex industry. My question in this project is to explain the difference between those two countries. And I'm looking at 5 different dimensions or aspects of the response. And these dimensions I've listed here, so it's containing the institutional framework. This is what institutions have been established to deal with this policy problem, but it also includes the legal regulations and policy regulation that are guiding the work of these institutions. The second dimension is financing. Financing obviously includes all sources of funding, most importantly government funding, and funding by international donors or bilateral donors. And here we are going to look into those different sources of financing. Then the third dimension is implementation. So implementation of treatment, prevention, care and support, which are the 4 pillars of the response to HIV/AIDS. And this is actually including the prevention programs that I've just tried to explain to you, like as one example, and could also include other forms of prevention. It is very important here to include implementation, as obviously the response to an epidemic cannot just consist of the policy as it is written on paper, but it should also be implemented. And just in the implementation, one can face a number of barriers, that make it difficult to implement a policy. And because this is important, it is included here. The fourth dimension is the cooperation with international organizations. This, of course, has a lot to do with financing, as some of these organizations also provide funding or financing. But it can also include knowledge transfer, everything that international organizations do in cooperation with the national governments. And the fifth dimension is the participation of civil society. This includes the participation of non-governmental organizations, most of them from the countries themselves. It can also include international non-profit organizations, but as we will see, most of the organizations are based in the countries. And the underlying assumption here is that if civil society is included in the response to HIV/AIDS, this helps addressing the epidemic. So that's an important element in the policy response. So as you can see here, the 5 dimensions, I'm going to look at the 5 dimensions, and from a theoretical perspective, I'm using the book by two researchers, Tony Burnett and Alan Whiteside. And what they have done is they have written a book about HIV/AIDS in the 21st century. And they introduced some very important concepts, and one concept is the risk environment. So the risk environment includes all aspects of risk, ranging from individual risk to societal risks. Yeah? And these risks affect the spread of an epidemic. Yeah? So individual risk can include all kinds of behavior. Yeah, if you are using drugs, you're more likely to have to get infective. So that's an individual risk. But then, looking at a society, the percentage of injecting drug users is also a societal risk. And with this construction of an risk environment, it is possible to understand what the risks are for if we look at the societal level. Okay, so now I would like to tell you something about the data that I'm going to use. Obviously, I need a lot of literature. Here it's like existing literature on these topics. What is interesting here is that there's nearly no political science literature on the topic of HIV/AIDS. Most of the studies are addressing very specific medical questions. Yeah, so the literature is very it's a very closed body of literature that it's not so accessible. Yeah, and this actually is one problem in discussing these issues, yeah, because medical doctors have, of course, a forum for discussing it, but it's hardly ever discussed beyond the borders of this community, and so it's very difficult to actually have also a public debate on this. Yeah, it's mostly confined to the medical sphere. The next sources is statistical data, which I need in order to understand the course of the epidemic and how things are evolving. And most of these data comes from the government sources. And then I'm using interviews with key informants, which can come from 3 different groups of organizations, from state officials, from international organizations, and from civil society organizations. And talking about the course of my research project, I'm very much in the beginning with this. I conducted some interviews last year, and now I'm preparing for a second round of interviews. Okay, let us start now with the epidemic impact. This is the development of the HIV/AIDS epidemic in Russia. The orange curve shows you the development of officially registered cases. So as of October 2015, it has been 907,000 cases of HIV infection. And now it is said that this number has crossed the 1 million mark. What is interesting here is that these data are published by the Federal AIDS Center. However, it has not been renewed, the information over the last 2 years, which is strange. So the Russian Federal AIDS Center used to publish all the information on its website, but it has stopped to do so over the past 2 years, or since 2014. What you can see here is that the epidemic started very late in comparison to other countries, yeah, and it had one peak at around the year of 2000, 2001, and then over the last years it is again growing with accelerating speed. Yeah, so you can see here these are the new cases, and here you see one peak, and here you see that it's growing over the last 2 years. And just to give you some indication, the growth numbers are growing by 10% per year. So each year it's 10% more new cases. That's an estimation. I mean, of course, it's always changing a bit. Well, just to give you also a comparison, in 2014 there had been more than 85,000 new cases, yeah, in all of Russia. In Finland at the same time, or in 1 year, it had been only 173 new cases. Yeah, so that's a huge difference. Yeah. And okay, Finland is also a country with a very low prevalence rate, but also in comparison with other countries in Europe, this is very, I mean, as new infections per year, this is very high. So Russia is in Europe the country with the most new infections per year. So now we have a look here at the epidemic impact in Ukraine. And here what I have not found yet is the overall number. So this is only a graph that is showing you the new infections. And what you can see here and what is important is, first of all, in Ukraine, the epidemic started earlier than in Russia. So it already started in the middle of the 1990s. However, if you look on recent years, you see that it's not growing anymore, but more or less, yeah. So it's not growing, but it's more or less stable or even decreasing. Something that you can also see here, and this shows you green the number of registered HIV cases, and this is the number of registered cases per 100,000 tests. And I think what also becomes quite obvious with these graphs, it's not very straightforward to get the right interpretation of the data. Yeah, so you have about 10 different ways to describe the development of this epidemic, either that it's cases per 100,000 of the population or cases in absolute terms. And in order to understand it, you have to take into account many different ways. Yeah? And what you can see here, for instance, which is yellow, is the number of cases among this one key population, injecting drug users. Yeah? And also here, it more or less shows that it's stable or even slightly decreasing. Yeah? And this is actually a good sign. So in Ukraine, different data show that over the last 10 years, the epidemic is decreasing. Yeah? In contrast to Russia, where it is still growing. Here's a graph that's combining these two things. So these are orange is newly registered cases in Ukraine, whereas gray is newly registered cases in Russia. This is absolute terms, so in absolute terms, of course, Russia is much higher than Ukraine, but this also has to do with the fact that the Russian population is bigger. But you can see here that in Russia it's still increasing, whereas the orange line is stable, yeah, more or less. So the difference between Russia and Ukraine is getting bigger. And you also see this in the prevalence rate. Prevalence rate means how many people per 100,000 are infected by HIV. And this is 494 in Russia as compared to 313 in Ukraine. And this used to be different. So There was a time in the late 2000s when actually the prevalence rate in Ukraine was higher than that of Russia, and it has changed over the last 5 years. Good. Okay, so this is a short summary. Yeah, the recent development is in Ukraine you have a slowing down of the HIV epidemic, and in Russia you have a growing epidemic. And that also means generalization of the epidemic, and with generalization this is meant that the epidemic goes out of this confined key population and is more and more affecting the general population. And this can be actually seen in tests among pregnant women. So it's a general international practice that during pregnancy, women are also tested for HIV. By this, also the infection from mother to child can be prohibited. Yeah, so therefore it's important to test this, but it's also an indication of how high is the prevalence in the general population. Yeah, so not in specific most at-risk groups. And here one can see that in Russia there's currently a generalization of the epidemic, that it goes out of the key population and might affect anyone in society. Okay, this is just to show you that in both countries it's not evenly spread, so there are regions that are hotspots of the epidemic. In Russia this is the region of the Volga, and in Siberia, for instance, Irkutsk, and also St. Petersburg and Leningrad regions among those regions in Russia that are most affected. And this mostly has to do with drug trafficking. So those regions in Russia that were most targeted by drug trafficking were also those who developed a huge HIV population. However, it also has its own dynamic. Yeah, but you can still see that it's mostly spread in urban areas or in regions with big cities, and in those industrialized regions or regions where you have a lot of transportation or traffic. Yeah. And peripheral regions are very less affected of HIV. So now we come to the policy response. The institutional framework. In Russia, there's one institution that is responsible for the HIV epidemic. That's the Federal AIDS Center, which is a subdivision of Rospotrebnadzor. And in its tasks or responsibility, this center is subordinated to the Ministry of Health. However, it's not a part of the Ministry of Health. This has practical consequences. It means that people with HIV infection do not receive their treatment in regular hospitals or polyclinics, but in specified AIDS centers. That can have practical consequences, that people need to travel to these centers. Usually per region there's one center in the regional capital. And the regional AIDS centers provide then testing but also treatment to people. Yeah. Interestingly, last year in October, a new strategy on confronting HIV/AIDS was adopted by the Russian State Duma. This strategy is a very general plan of action, and it's not very specified. So you will not find any allocation for financing within the strategy. And what is also important of the institutional framework is that there have been a lot of tensions between this Federal AIDS Center on the one hand and the Ministry of Health. So in 2015, the director of the Federal AIDS Center declared the HIV epidemic to be a catastrophe for Russia. So that was a public statement he made. And as a response, the Ministry of Health said that he was a foreign agent. There's just to see that these institutions sometimes also work and contradict each other. This is the situation, the institutional framework in Ukraine. There had been several reorganizations, and now the main state institution at the Ukrainian Center for Socially Dangerous Disease Control, which is part of the Ministry of Health. And Ukraine also has a strategic plan for the years 2014, 2016, and it's renewed with each new year. So now it's another plan for 2015 until 2017. Now we come to financing. In Russia, one sees that there's, well, in general, I find it quite difficult to obtain reliable information on the financing situation. It's not specified in the US government strategies. What you can hear and read in all of the media reports on HIV/AIDS in Russia is that there's a very serious gap in financing. So there's not enough money for treatment and for procurement of medication, and also not for prevention activities. So there's a huge shortage of financing. And in a discussion of the new strategy, HIV 2020, this was also a statement by the Ministry of Health, that it was said the implementation of this strategy depends on the allocation of money. So in other words, they themselves do not know at this point whether there will be funding for the implementation of the strategy. So that's very worrisome. We now look at financing by international donors. It is so that Russia received international financing in the first decade of the millennium from the Global Fund, for instance, and also from a number of bilateral programs, so from international development organizations or from other countries that were working together with Russia. However, as Russia is a middle income country, and the general a mechanism of the Global Fund has excluded middle income countries as recipients of aid, the country no longer qualifies as a recipient. And this means that at this moment there's no significant external funding from any international organization. I cannot exclude, of course, that there are small organizations that are still funding HIV/AIDS activities, but that's at a very local level, so not at a significant amount. That's very different in Ukraine. Ukraine receives a lot of international funding from the Global Fund, but also from bilateral organizations, so that can be USAID. And there are at this moment 3 different main recipients of Global Fund aid projects. One is this main state institution, the UCDC, and the 2 other organizations are actually non-profit organizations that are working in Ukraine. However, also in Ukraine is facing declining levels of international funding. So just some years ago, the dependence on the Global Fund was quite huge, and the recommendations was to to actually shift the responsibilities and to increase the state funding. So now it's a call on the Ukrainian state to increase its own funding, which however is difficult in the current economic situation. Now we come to the third dimension, that's implementation. Here we also see a huge difference between the two countries. In Russia, it's so that there is in general a lack of prevention programs for the so-called most at-risk populations. These populations include injecting drug users, but also sex workers, prisoners, and men who have sex with men. And in general, there's a decrease in prevention programs specifically for these groups, and here I forgot to add, due to the decrease of international funding. So in the first decades, when there was still international funding, most of this funding that went for prevention went actually for very specified prevention programs. When we look at treatment, we see that Russia has a low level of access to antiretroviral treatment. That's the common treatment for HIV infection. And according to one source, only 30% of those who are in need of this treatment receive this treatment. However, also here, there's a debate on the data. So the data I found tell me 30%, but it might have been changing since 2013. Let us look at the situation in Ukraine. In Ukraine, what is important, there has been a major policy shift in 2004. 2004 was when still the Kuchma government was in place. It was in the month before the so-called Orange Revolution. And at that moment, the government of Ukraine decided to invest more in these prevention programs for most at-risk populations, and also adjusted its internal policy regulation towards this. And if we look at treatment, the access to treatment has been increased over the last years. So according to one report, it is now above 90% according to, if you compare to those who are in need of treatment. Yeah, so it has been significantly strengthened or increased over the last years. However, there are a lot of gaps in service implementation. So there are differences between the regions. Yeah, some regions have better service implementation than other regions. Also, you see differences with regard to target groups. Some target groups are better served than others, and a particular field of concern was, for instance, services for men who have sex with men. So the general male population did not receive the services that one would think that they need. So that is the picture for Ukraine. Still, in comparison to Russia, the situation is much better. Now this is the fourth dimension. This is looking into the cooperation with international organizations such as the World Health Organization or UNAIDS or the Global Fund. So in Russia, one can see that there's a resistance towards prevention programs advocated by those international organizations. Most of these programs have not been introduced. If they have been introduced, it was only at the local level. So some of the regions, for instance, had harm reduction programs. However, the coverage of these programs is very low. if it comes to opioid substitution therapy, this is legally banned in Russia, and it's not legally banned in Ukraine. So as part of this policy shift that I've mentioned is also the introduction of substitution therapy. And why it is important here? It is important because it helps drug users to stabilize their life, if you want to say so, and also to be included in prevention programs or in treatment. Yeah, so it's generally regarded to be the first step for all kinds of prevention activity. Therefore, it is important in this regard, although it's not directly addressing HIV. So in Russia, you see that there's a lot of resistance, and there's an anti-Western discourse connected to these programs. So they are described as harmful and not Russian and not according to Russian culture. And this has actually been intensified over the last 2 or 3 years. So you find a lot of discourses or media statements that support this. In Ukraine, the situation is different. So in general, Ukraine had been much more dependent on these international organizations from the financial perspective, and this resulted in the fact that it has more accepted advice from these organizations. Yeah, so the policy shift in 2004 was very much advocated by international organizations, and we can assume that this was because of this advocacy. And so in those interviews that I had with key informants, this was actually, I was told that this was very much because of the influence of international organizations, but it's something that I still have to look further into this question. Now we come to the last dimension, and this is the civil society participation. Also here we can see in Russia it's actually decreasing. Yeah, a lot of organizations are marginalized. In the 2000s there were still about 158 service NGOs, most of them local or regional, and this number is decreasing, and some of the organizations have been affected by the so-called foreign agent law. So they are actually included in the list of foreign agent, although you would not consider HIV/AIDS as a political activity, they're still included in this registry. And some of them have also ceased to exist, or their activities are very much endangered. In Ukraine, this is not the case. The cooperation between civil society and the states is difficult, but it's still developing. The challenges are that some of these organizations have a very low capacity. They still have a lot of financial dependence on foreign donors. However, they are working together. So these are the 5 dimensions, and now I would just like to mention this as well, because obviously you can ask, so what has been the impact of the war in eastern Ukraine? This is just one remark about that. So as I told you, these prevention programs, they are legally banned in Russia, but they are allowed in Ukraine. So when Crimea became part of the Russian Federation, a lot of these programs were closed down, and most of the clients in Crimea have transferred or fled, you can also say fled Crimea. And there were special programs set up in Ukraine to assist the transfer of these clients, to make it possible that they can actually continue treatment in Ukraine. Okay, now as I see that my time is coming to an end, I would like to show you this comparison here. These are the 5 dimensions, and I compared this, and here you can see that there are significant changes, differences. The most important one are regarding the financing and the implementation. You see that when it comes to implementation in Russia, you have this resistance against internationally advised programs, whereas in Ukraine you see this shift in 2004, which also meant that there was an introduction of many of these programs after 2004. So the results of my study as they are now are the following. So one can see that due to the introduction of prevention programs, we actually have a slowdown of the epidemic in Ukraine. It's still, it's very difficult to, it's still an hypothesis, yeah, because as you have seen, it's a difficult interpretation of this whole statistical data, but you can see that there is a slowdown when it comes to HIV/AIDS among key populations. This was facilitated, or this is due to this policy shift and the cooperation, or growing cooperation between international organization and local civil society. In Russia, you have a completely different picture. So you have not seen the introduction of prevention programs for most at-risk groups. You have a new strategy, but there are no concrete plans for implementation. What you can also see is that Russian civil society organizations, they find it really difficult to continue their work. And one of these representatives told me, we are left alone as a hopeless case, which means that for them it's very difficult to obtain any funding. They can neither obtain funding from foreign donors, but also not from state organizations. And many of these organizations, as a consequence, cannot continue their work, and they compare their situation, for instance, with organizations in Ukraine that, although facing a difficult economic situation, can still continue with their work. With a bigger picture, this is actually something that we might come to at the discussion. So here you see, if you compare the two countries, what we can conclude is that these internationally advised programs really work, or it can be interpreted in the way that that international organization actually bring out a good advice, at least in Ukraine, or the situation in Ukraine showed this, and it can be seen as part of a general effort to stabilize and to develop the country. In Russia, you see that Russia does not really have a coherent strategy, and then of course we can ask the question, is this telling us something for the situation of social policy in Russia in general, or this exceptional just for the case of HIV/AIDS? And this is something I would like to discuss with you as well. But first of all, thank you very much for attending and for being here.
Thank you.